An upsetting update from music legend Billy Joel today. According to a statement posted on his Instagram, he's suffering from normal pressure hydrocephalus, or NPH, a condition that affects the brain. It's forced him to cancel his upcoming tour. As it turns out, Albany Med is participating in a clinical trial right now for a new surgical procedure that could help people with NPH. Normal pressure hydrocephalus, or NPH, is a neurological condition that can cause problems with hearing, vision, and balance.
Essentially, there is a buildup of spinal fluid in the brain, and that can cause the patients to have difficulty walking, some urinary problems, and then also memory problems.
Symptoms that can often be confused with those of other neurological disorders like Parkinson's or just aging. But Albany Med neurologist Dr. Alexandra Paul says there's some good news that comes along with this diagnosis.
For patients who have normal pressure hydrocephalus, it's really important to identify that because many of these symptoms can be reversed with the procedure.
The current standard procedure, a ventriculoperitoneal shunt,
which is where we drill a hole in the skull and place a catheter into the fluid-filled space in the brain, and then tunnel everything underneath the skin so it drains into the space around the belly.
But now Albany Med is participating in a clinical trial called STRIDE, looking into a new procedure involving an E-shunt. This shunt is placed near the groin and then fed through the femoral vein to the brain. The shunt is then implanted at the base of the skull, draining excess fluid that's naturally reabsorbed by the body. Doctors say it's less invasive than the current procedure, and with further research and trials, could be used to treat other conditions.
There also are plans for this device to be used in other kinds of hydrocephalus, so post-traumatic or after a ruptured aneurysm, or a disease called idiopathic intracranial hypertension.
Big takeaway there that with the right procedure, normal pressure hydrocephalus can be reversed. The STRIDE trial at Albany Med has 7 patients enrolled right now, but they are looking for more. So if you're interested, we have a link to the clinical trial patient portal on this story on our website, cbs6albany.com.